Good morning. Hope everybody is doing well on this Saturday. I know it's been some difficult times. It seems like the world is rushing pretty quickly into a full lockdown here in Montreal, where we're pretty close to being a full lockdown. And from what I'm hearing, grumblings of in a couple days are going to announce some pretty serious lockdowns. So it's pretty hard times with the holidays coming up. People feeling disconnected already from their friends and family. Now here comes the holidays. Everyone's even more disconnected, and that can cause a lot of pain. And one of those types of pains can be spiritual pain. And people who are diagnosed with dementia still have a spiritual being that needs attention, that may be hurting and be in pain, as well as their caregivers. And I'm so excited to have Dr. Daniel Potts on today. He's an attending neurologist at the Veterans Hospital in Alabama. And I want to share with you a quote that he put up on LinkedIn, and this is what prompted me to reach out to him. He wrote, "Brain cells become disconnected. Spirits do not. Relationships matter in people living with Alzheimer's and other types of dementia." When he talked about spirits still being present, I mean, it gave me goosebumps. I talk about this in my book, Plan for Aging Well, which you can find on Amazon. And as you see, the title it has to do with attending to the body, mind, and spirit. And that's one of the things that I've been advocating for a long time, is that, as we age, our whole person needs attention. It's not just the physical body that's aging, it's our mind that's aging, our emotions, our spirit, and everything should be equally attended to, in my opinion. And what was so exciting about hearing Dr. Potts or seeing Dr. Potts write this was coming from a physician. And I'm not knocking physicians. Physicians are incredible, but they're very scientific, thankfully, because we need them to be scientific. And spirituality and science don't really match for a lot of people. So it's very exciting for me to hear that he's leading this movement. So welcome, Dr. Potts, and thank you so much for being here.
Thank you, Stephanie, for asking me. It's a pleasure.
And I love your accent, by the way.
Oh, thank you. It's Alabama,
I
through and
know.
through.
Yeah, I love it. I love it. How's everything going down there? Just checking in terms of, like, are you guys in lockdown and stuff down there?
Yeah, we have the governor just extended our sort of lockdown order, our masking order, social distancing order. So we lagged a little bit behind some of the larger metropolitan areas, but
Okay.
but we're definitely feeling the brunt of it now, worse than since the pandemic started. So yeah.
Yeah, it's a hard time. So let's get started on the topic. Talk to me about what you mean when you wrote that I saw it on LinkedIn, as that our spirits are still there. What do you mean by that? Coming from this scientific medical background, what do you mean by it, and how do you synthesize that training versus this non proven type of approach?
Well, thanks for asking that because it's incredibly important. And I have to, in answering that, briefly allude to the inspiration of my father, Lester, who had Alzheimer's. At a time when my neurologist's brain was trying to get a handle on the losses that Dad was experiencing, and therefore we all were experiencing that loved him, Dad began to paint. And through that artistic creativity, showed us, me, that he was still inside and that some essential part of him, the most essential part of him, actually, I believe, was still pulsating with life and trying to communicate his story. And he did so through art. That revolutionized my practice, the way I look at people, the way I regard disabilities. And so I now see that element, the spiritual element, the persistent element, as the most important thing to access in dementia care. That's quite plainly the way it happened.
I'm like welling up my eyes hearing this, because it is so important that we attend to this part of people. And I worked for years as a palliative care social worker. And so I saw people at the end of their life. Many of my clients had dementia, but there was also other sorts of illnesses. Majority were probably 70 and above, but the youngest patient I worked with was 12. Obviously it wasn't dementia, but I saw how important spiritual care was, and I saw the direct connection with spiritual pain and physical pain. And those people who seemed more comfortable spiritually seemed to have less physical pain. And so I really saw the connection. Do you see that related to like symptoms with dementia and spirituality?
Yes, I do, and actually, a lot of our education on this came through the end of life care that Dad received because we also had the hospice experience with Dad, and there were so many. I could talk for hours about the experiences that we had that were spiritual in that place. But yes, I do. I think that certainly evidence is showing and has shown for a long time that people who employ the spiritual in their health struggles tend to do better in terms of well-being, in terms of the ability to fight infection, in terms of depression indices, and all of these things. And so there's a lot of evidence to show that accessing the spiritual is beneficial. And this may or may not have anything to do with religion. In a lot of people, it does. Religion and faith background, that matters to a lot of people, many people. But what it means is reaching a depth in our care, in our contact, in our communication with an individual, a depth. And there are many ways to do that, as we may talk about.
Dr. Potts, you started to talk about something that I was going to ask you because a lot of people equate spirituality with religion. So when I'm asking my clients' families or my client if they're still able to communicate in some way, tell me about this person's spirituality. How can we integrate this into care? The most common answer is my dad wasn't religious. My mom wasn't religious. And I think, well, neither am I, but I consider myself an incredibly spiritual person, and it has absolutely nothing to do with being Jewish. In fact, it's like I don't even see I mean, there's maybe a connection, but maybe not, you know? So how do you define then spirituality for people when you're trying to introduce this concept to not only your patients and their families, but your colleagues? How do you, well, maybe actually hold off on the colleagues because I want to get to that separate. How do you define spirituality and begin to introduce this?
Well, and I'm not a theologian, or I'm a neurologist, but I define it as that which is essential in terms of personhood and relatability or relationships. I think it's the essential element that is innate, it's inviolate, it is not affected, I don't believe, by disease processes or anything else. It persists, and it calls forth out of us uh, vision to see it present. It calls forth relationship. Its energy is relational. So, what I'm talking about is the personal, the very personal, in the most profound sense of the word, and the very relational. And so these are things that build up the inner self, not only of the person living with dementia, but also of us as the care partner.
So relational, because you wrote an intro to the book, let me get the right title, Dementia Friendly Worship. Do I have the title right?
Yes,
Yeah, and
yes,
that's available on Amazon, Dementia Friendly Worship. And you wrote
yes.
the intro for that. And you talked about, I wrote it down. It was something I wanted to ask you, is that the most important part of spirituality is the relationship. So I'm curious, are you talking about the relationship with oneself, the relationship with others? Because I find for myself, and I can only speak for myself, I'm not a religious expert by any means, but I know in struggling with my own anxiety throughout my life, what has completely catapulted my healing has been connecting with spirituality. It has nothing to do with anybody else. It has to do with actually my relationship with myself. Is that what you mean, or do you mean like the relationship with your care partner, as you say?
Oh, that's a great question, and I mean all of it. I mean the relationship first of all with oneself, and with what I would consider the divine element of selfhood that we all have. I think whether we realize it or not, and then the connection outwards from that and upwards from that to others, to our environment, to nature, to the ambient surroundings, to God or a higher power, to all of those things. It is the utmost in connection to all of those.
So for someone, let's stick to this dementia world now. These symptoms are extremely challenging. I have the utmost respect for family members and friends who are providing care, for the healthcare professionals who are working in secured care settings with people who have dementia, because It's very fatiguing. It's 24/7. And sometimes the symptoms can be very disturbing, obviously, for the person who's experienced it and for those of us watching as well. How do you introduce or help somebody spiritually when their behaviors, their symptoms are things like anger, aggressiveness, violence, these kinds of symptoms that we tend to unfortunately medicate, which maybe we should have another discussion about that, about what I think is the overuse of medication and the underutilization of all of these other things. But how do you, like, what can you tell to somebody who's saying, look, I would love to, it sounds great to bring spiritual support to my mom at home, but she's always yelling at me. And she's so aggressive and she's fighting with everything I do. Where do I even begin? What would you advise?
Well, and that's a tough and an essential question. And one of the things I would start with is to say the spiritual is really the physical also. I mean, I believe that the spiritual courses through every cell, every task, every behavior. And so that when we're talking about this, we're really talking about embodying the present moment, whatever we encounter. And so I think a lot of it has to do with taking a position of being empathetic, taking the position of a listener who is able to listen and discern that person's language that they may be speaking without words. This is someone who's hurting. There are reasons that they are hurting, and so it becomes a stance of being open, non-judgmental, empathetic, and being a listener to what is going on with that person. And I think if we take that stance of non-reactivity also, because it's so easy to react to what we're presented with emotionally. But of course, a person with dementia does the same thing. They react to our emotions that we present them with. So it's important to not be non-reactive in this encounter, but it is very much an embodied encounter. We're not talking about some loftiness, or mantra that we're uttering and not entering into the daily caregiving world. It's very much where the rubber meets the road, but it is a stance that we take, I think, that we just described.
It's beautiful. It is so beautiful what you just said. And I like that you're, first of all, that you're talking about that it's not necessarily religion and faith, which it can be. And I think that's just as important, and to integrate that in the ways we can. But it's sometimes those integrations are not possible with the situation that we're in with somebody who's struggling with some really intense symptoms. And so I think it's important for healthcare professionals like you and I to help caregivers understand that so many things they're doing is providing spiritual support, because caregivers feel so ineffective and so lost and so helpless, and they get caught up in the tunnel vision of bath time, meal time, give medication, move from the chair to the couch, all of these like task oriented things, that they're not realizing that when they're cooking and they're making, I don't know, chocolate chip cookies with a dash of cinnamon, and the cinnamon brings the person back to the same cookies that his or her mom made, and the aroma is in the house, and when you're giving that is feeding somebody's soul. And so I think it's really important that these discussions come out more, and that us as healthcare professionals help caregivers see that they are providing that support so they can feel better about what they're doing.
Absolutely, that's a beautiful illustration, and it talks about and embodies mindfulness.
Mhm.
These practices where we attend very intently to what we're doing, the significance of what we're doing. There's a wonderful book you may be familiar with called No Act of Love is Ever Wasted by Dr. Richard Morgan and Dr. Jane Tybalt. And in this book, they talk about everything we do in the caregiving environment that we do intentionally for the betterment of this individual. It makes an eternal difference. It's sort of one of those, this adds to the good of the world that goes on and on, I believe. And so that's what we're talking about doing, these very intentional things. And a lot of it means changing the way we view things. We look at things as expressions of growth and not decay. What we are doing that has this incredible weight to it, this incredible importance and this love and this care, this promotes growth. in contradistinction to decay, both of our own character and of this person's character. So as you know, love grows and expands. That's what we're talking about. We're talking about the expansion based on a paradigm of loving relationship. That's what this is.
Dr. Potts, how do your colleagues take this position that you take? Are you like an anomaly? Are people thinking that you're the crazy one no one wants to eat lunch with you because you're off in the corner like there's that foo-foo doctor who's not really practicing care? Or are they open? Are you able to have any success in like inspiring your colleagues to treat their patients differently?
Well, it's a great question too, and I have the utmost respect for my colleagues, and I know some wonderful ones. And I will have to say that a lot of what I'm telling you now came through struggle, and came through hardship. In a lot of physicians have not been care partners for a loved one that has a disability or dementia. And I wasn't the primary caregiver. My mother was, but I assisted enough with it as a secondary caregiver. And then the other thing that happened to me is I fell apart post Alzheimer's in my dad. After my dad passed away, I was not espousing the things that I'm talking about right now, or at least not bringing them to work in my own life. And so I fell apart. And so coming out of that, I realized that a lot of what I'm talking about actually is self care too. And so it enables me to do what I do. Having said that, I will say that I think most a lot of them are receptive to this. I think the incredible time constraints that physicians and other providers are under right now, as you know, it works against this kind of thing. But I think I think there's it's taking hold, and I think you're seeing more people talking about this now and the importance of it, both in training physicians and in practicing empathy throughout the lifespan and in not burning out. Physicians have a high burnout rate, as many other specialties do, above 60%, 65%. So, in order to care for people, we're going to have to take care of ourselves spiritually. And I will say also that we need to be promoting living well, not just trying to cure somebody, not just trying to give them an effective treatment pharmacologically or therapeutically. We need to be talking about helping them to live well, even if they have a terminal diagnosis like dementia. This is not a death sentence. They will die of the condition usually. However, we have to promote living well, and a lot of that's what I'm talking about here.
That's a big shift, right? Because your profession is the intention is to heal, to stop something from spiraling, stop an illness, make it never come back. I mean, that is how you're trained. So that is going to be a very big shift. And I wonder if, and this is very like macro, but I wonder if there will be a point when all of the medical schools around the world will begin to integrate these courses for physicians who are in training for students, because I think we have to start there. That is like when I first wrote my book, I was telling my book coach, it's not really written. Professionals can read it, but it's not a textbook. But I said to her, I think maybe I should write a second version as a textbook, because I would love for medical schools to have this, or nursing programs and social work programs and physical therapy programs for all of us as healthcare professionals to look in the way that we care for people differently. And I think in integrating it into curriculum, to add to your point, Dr. Potts, it would make us look at ourselves too and realize, okay, I need to be doing this first.
You have touched on something that is really a powerhouse, because that's what I think this can do. I mean, and I think social work training programs, probably in nursing training programs, et cetera, are doing a much better job than medical schools are now. But medical schools are catching on, and residency programs in the building of empathy, and in getting physicians and training inside the bodies and minds and spirits of people living with disabilities. Because when you do that, when you come into a relationship with somebody living with dementia, it changes you, it transforms you, and it brings things out of you that then are going to feed others throughout your career. So I think it's very important that we do just exactly what you're talking about.
I hope we do. I'm when we're just talking about, experiencing dementia firsthand and how it changes you. Next week I'm going to be interviewing someone who there's a student movement, and what they're doing is they've created something called Care Corps, which they want it to be like the Peace Corps, where high school students can get credit and also post high school do a period of time as if it were the Peace Corps and earn credits providing respite for caregivers who are caring for someone with dementia. And in my mind, I'm like, oh my God, this is the key. Get this younger generation hooked on this, understanding the power of being in that field and how we need to change the way we do things, and then hoping that that builds, because the numbers are not in our favor. To me, we're like way behind the curve in changing the way we're managing this disease.
Yes, exactly. And you're seeing more and more organizations doing that. Youth Movement Against Alzheimer's and other
Yeah.
organizations are doing those sorts of things, and it's beautiful. You know, another thing that's happening is that the use of tech, virtual reality is making a big impact here. For instance, Embodied Labs is an organization that I've done some consulting with, and it's a wonderful group of folks that again got their start through a personal interaction with a family member with dementia, Carrie Shaw, and they are building a beautiful program whereby they have created modules of the first person experience of dementia, and they're getting people inside that world, and also they're dealing with loneliness now and some other modules. And so I think the more widely these are utilized, especially in this pandemic time, the better impact.
Yeah, and I'll get to the pandemic because I do want to ask you a question about that connected to spirituality and dementia. But let me just ask you, like, you know, like very specifically, how can a caregiver, because I'm trying to imagine that some of the people who will be watching this are caregivers and not professionals. How can a caregiver start with saying, okay, what, excuse me, what is spirituality for my loved one? What is spirituality for myself? And how do I today immediately be either become more aware of what I am doing already, or find a way to integrate it in? Now, for me, I'll just tell you how I explain spirituality to people. For me, it's the moment when the world shuts off and you're just in your own experience. So I see it when I watch one of my neighbors garden, and she's got this little smile on her face and she's humming. She is nowhere but in her spirit, hands in the ground. So for her, it's gardening. To me, that's her spirituality, and probably other things. I don't know her that well, but I know when she gardens, that's what I see. For me, it's when I'm doing the flying trapeze, which sounds kind of crazy, but I don't think about anything else. I am completely absorbed in this world. And there are ways to integrate that in if I'm, unable to move later, holding a bar, putting chalk on my hand, watching old flying trapeze videos. That's feeding my spirit. So that's how I explain it to people. Can you give some insight to how you would suggest that people can understand the spirit of themselves and someone else they're caring for and immediately do something?
Yes, that's a beautiful illustration, by the way, and it touches on exactly what I'm about to say. So we talked about the spiritual being very personal and very relational. And so what I encourage people to do to start with is to think about the personhood of their loved one or their care partner, what makes them who they are. I call those pillars of personhood that persist despite dementia. Why did you fall in love with that person? What do you value most about them? What brings them to life? Well, those are the things that are still going to be present despite the fact they may be hidden somewhat by dementia. So if we can learn to tap into those very things, thereby bringing that person to life, then the second part, part two, the relational part, will then follow because we'll be able to be in relationship in the moment with those elements. And like you said, time will stand still. We'll be together. And it's a place of depth. It's not a superficial place. It's not a denial of reality. It's very much accepting it, but it is looking for those essential elements of personhood. I would call that the spiritual, and beginning to look at those times and be grateful for those times of connection, seek them out, not be in denial, not hold your loved one accountable to be what they were 20 years ago for you. So that relationship that I had with my dad 20 years before Alzheimer's was very special. But for me to hold my dad accountable to be that for me, now that he has Alzheimer's, is not fair to him or me. And so I have to take that icon of a relationship and set it aside so that I can be present with him now and relate to the dad that I see in front of me now, who's the same dad, but is not capable of certainly all of those things that he was. So again, personal and relational, I would call that spiritual.
I agree. I agree. And I think it will help the caregiver as well feel effective. And like I said earlier, caregivers feel so ineffective and it burns them out because they feel like no matter what they do, it doesn't matter. And so this is a way for them to kind of cement moments where they realize that even though the dementia is progressing, what they're doing is very valuable and very meaningful and it matters. It matters a lot.
Yes, there's reciprocal energy. It has to flow back and forth, otherwise we burn out,
Yeah.
which happened to me. But you have to see the uplifts. You have to be grateful. Gratitude's a big part of it, you know. Put on
Yeah.
your gratitude glasses. I mean, and see those things and be grateful for those things that you still have.
And how if somebody's spirituality is very it is faith-based and this person, this team, meaning the patient and the caregiver, the team, the unit, were people who were very active in an institution. And that was something that they attended, weekly or multiple times a week, whatever it might be, but there was a very big connection. And then now due to the symptoms of dementia that might be not manageable. And I read that in your intro, how there were some symptoms that your father had when he was, in church. And but it sounds like the clergy were very well informed and they were, helping and supportive. How can you get that in if the person is not capable of going out anymore into these organized settings? How do you bring that into the home?
Well, I would, for an in-depth study of this, I really would recommend the book that you mentioned earlier, Dementia Friendly Worship, edited by my friends Linda Everman and Don Windorf, and this wonderful team of editors and contributors, because they really have gotten folks together to talk about this in a beautiful way. And Faith United Against Alzheimer's, which is a division of the organization Us Against Alzheimer's, is made up of clergy and other faith leaders who get together and talk about things like this. And there's some people that have written about this beautifully. But I think that you have to honor the person's worship tradition, faith tradition, in which they were raised, and which still holds meaning for them. I think that you have to take a very truthful look at their deficiencies now and the limitations that they have, as I talk about in that introduction, that are going to limit their ability to participate in worship. And I think you have to hone it down to the essential elements. And at some point, that may be a presence, a touch, smells, sounds that are gently apportioned for the person so as not to alarm them. I mean, when Dad was in hospice and his clergy came and offered him the Eucharist at a time when he was unable to do that himself, and he did partake, that was a very, very powerful thing. And it calls to mind the idea that we are never forgotten. There's this whole, and I even had this concern. Would Dad forget him? Not only forget himself, but would he forget God? And would God forget Dad? And of course, in our belief system, we believe that God doesn't forget anyone. That God has each of our names written on the palm of God's hand, and that projects back into our current reality. And so, at some deep level, in a person living with end-stage dementia, that there is a knowing that that person is not forgotten. I do believe they have an innate awareness of some type that they are not alone. I can only hope and pray that, Stephanie. So I think presence is important. I think those elements that may not have to do with speech necessarily are important, and being there for that person, bringing it to them if we can. Music, the arts, the creative arts, the worship arts also are very important.
there's a few things that I just want to highlight. What you said is honoring the person's belief system, even if they can't verbalize it in the current time. And I think that applies, it's a bit off topic, but to a lot of things. Like, for example, if someone kept kosher their whole life and now they're living in a residence and the residence is not respecting that, it drives me crazy. Just
Oh,
because a person can't verbalize it, that was their entire life, was keeping kosher. And now you can't. I mean, I understand maybe if it's a, a non-denominational residence, it might not be easy to keep kosher, but at least don't give the person a hamburger. Like, like that kind of stuff just
no.
drives me crazy. The other point that I want to just say is I would love it if we could take the concept of hospice and just explode that into all healthcare worlds. I wrote in my book that I advocate that in every single nursing home there should be a full-time chaplain to attend to the spiritual needs, and not just faith-based, all spiritual needs, as we're talking about the whole thing. And one of my editors said to me, full time, I think you should edit it out. It's not realistic. You should put part-time. I said, hell no. It should be full time. That's why I'm writing it. That's exactly the point, is we should not be minimizing that. Do you feel hopeful that like we're moving in that direction?
Yeah, I think we are, and actually, the pandemic, may have that may be one of the unintended consequences of this pandemic. So many people are suffering alone, dying alone. It's made us value relationships more, end of life care, hopefully more. So I think as we come out of this, hopefully there's going to be a renewed interest in making that kind of paradigm available for everybody.
I hope so. And this was kind of the last thing I wanted to cover, was the implications of COVID on spirituality and dementia. And I think it is opening our eyes to the importance of this relationship, the relationships, the personhood, and all that. Unfortunately, again, we're behind the curve, and so people are not getting that at the end. And what I think it's going to do for a lot of people is those that have survived and the spiritual crises that they will be in, going over and over again, the last moments that their loved ones experienced in spiritual and physical pain, and them being unable to do anything about it, and the tremendous guilt that is going to leave with people. So I think we have a lot of work ahead of us in terms of the mental health and PTSD for caregivers alike. Because I mean, I was just reading something this morning where someone was telling me on a Facebook group I'm involved in that has to do with services in the area I live. And someone was saying that her father was, they're both in a nursing home, her parents. Father contracted COVID, 4 days later had died. Her mother contracted it, but is fine and is fully of sound mind. It's physical limitations, which is why she's there. But it's such a mess in there that the woman's not getting fed. She's not getting, her meals, but she can call her daughter and say, I need help. And her daughter can't go in, and my heart breaks. And so this is the piece, that spiritual pain, that I think is going to be a fallout of this pandemic. It's not just the lives lost, it's the lives that are still here, and the pain that they feel.
You're exactly right, and this also is a good illustration of what spirituality can do. A spiritual outlook can do for us if we sit with that pain long enough with an open spirit and to seeking some good that can come out of it, and looking for the light in there, then we'll come out of it stronger, and we'll come out of it with resources that we can offer other people. And so I hope that that's what we can do. There's something that sometimes suffering defeats us if we suffer in isolation, but if we bring that suffering into the presence of others and into the presence of God, then it will be redemptive.
Yeah, I hope that is my hope. I know I've been through a lot of really horrible things as a young child, and after I lost my father, I lost all sorts of stuff, and my accessing my own spirituality, learning about it much later in my life, has really healed me. And I'm hoping that it's going to be the same for everyone. I just want to read a couple comments that came up for you, Dr. Potts. I don't know if you can see them. So Susan said, thank you for your broadcast. Personhood and spirituality. I'm always looking for ways to connect with the person with dementia at all stages. And Meg said, I totally agree. I don't know at what point she wrote that. So it's so great. Other professionals are out there. feeling the same way as us makes me feel really hopeful. So the four of us at the minimum can work on this.
That's okay. Like you said, if one or two people hear and we start the dialogue, that's enough.
Yeah. So Dr. Potts, is there anything that you want to share that you're doing, or resources or way for people to get in touch with you before we end our discussion?
Well, I think one of the things that we sort of touched on a little bit, but there are a lot of ways to access the spirit, whether it be through pets, whether it be through children, nature experiences, music, expressive arts, faith. We talked about all those things. Those are important. Um, no, keep the banner high. Let's honor each other's personhood, and let's honor the relationships, and let's see this as acts of love that are not wasted, to have eternal consequences. No, our website for our foundation is cognitivedynamics.org. You can find me on Amazon.com, where I have several books out that I've written with my wife and others. And there are a lot of resources out there. Just keep the banner high.
Absolutely. And Dr. Potts, if on any of your movements you need someone to be involved somehow virtually from Montreal, let me know. I would be honored to join any of these movements that you're a part of, because I really, really appreciate the work that you're doing.
Well, same with you. I appreciate what you do too, Stephanie. Thank you for having me on.
Yep. And anyone can obviously get my book, Plan for Aging Well, on Amazon. As Dr. Daniel Potts said, he's got some books on Amazon too. He's written a lot. I've only written one. He's way ahead of me. uh,
Not
but
at all.
but go on Amazon. You can find us. We found each other on LinkedIn, so you can find us on LinkedIn as well. And thanks everyone for listening in, and we'll love to hear your feedback about what you thought about the show. Thanks, Dr. Potts. We'll stay in
Thank
touch.
you. Best wishes.
Okay.